Hello everyone, and welcome to this video dedicated to the anatomy of the pectoralis minor muscle. Though small and discrete, this muscle plays a crucial role in the mechanics of the shoulder and thorax. Understanding its anatomy is essential for clinicians dealing with shoulder pain, postural disorders, or surgical procedures. Today, we're going to explore its origin, course, insertion, actions, innervation, blood supply, and clinical significance. Let's get started. General overview. The pectoralis minor is a thoracic muscle connected to the upper limb. It belongs to the pectoral muscle group and is located on the anterosuperior surface of the thorax, while it is completely covered by the larger pectoralis major muscle. It can generally be outlined easily thanks to palpable landmarks at its origin and insertion points. Origin. The pectoralis minor originates from the external surfaces of the third, fourth, and fifth ribs, near their costal cartilages through fleshy and aponeurotic fibers. Anatomical variations, such as origins at the second or sixth rib, can have clinical implications, particularly in cases of restricted mobility or nerve compression. Course. From its origin, the pectoralis minor runs upward, outward, and slightly backward. It has a triangular shape with its apex oriented superolaterally. This muscle forms a deep muscular plane beneath the pectoralis major. It also covers important axillary structures, including the axillary vessels and the brachial plexus. Insertion. It inserts on the coracoid process of the scapula, specifically at the horizontal segment on the medial border. This insertion stabilizes the scapula during upper limb movements. Variations in its insertion may extend to adjacent structures, which can influence surgical planning. Actions. The pectoralis minor muscle has two main actions. 1. When the thorax is fixed, it depresses the scapula and moves the shoulder girdle forward, anterior tilt. 2. When the scapula is fixed, it elevates the ribs, acting as an accessory muscle of respiration. These functions are essential for forced breathing and upper limb movements. Innervation. The pectoralis minor is innervated by the medial pectoral nerve, a branch of the brachial plexus, C8 and T1. This nerve also innervates part of the pectoralis major. Damage to this nerve can lead to scapular instability or shoulder dysfunction. Blood supply. The blood supply to the pectoralis minor comes primarily from the thoracoacromial artery, with additional contributions from the lateral thoracic artery. This arterial network ensures adequate blood flow, even during periods of intense physical effort. Clinical significance. The pectoralis minor has important medical implications. 1. Thoracic outlet syndrome. Hypertrophy or contracture of the muscle can compress neurovascular structures, causing pain or paresthesia in the upper limb. 2. Shoulder impingement. A shortened or tight pectoralis minor can alter scapular movement, leading to shoulder impingement syndrome. 3. Reconstructive surgery. The pectoralis minor is used as a muscle graft in procedures to treat facial paralysis or repair defects in the chest wall. Conclusion. Now you know the essentials about the pectoralis minor muscle. You'll find all the scientific references in the video description. If you enjoyed this video, don't forget to like, subscribe, and drop your questions in the comments section. Thanks for watching, and if you're curious about why the pectoralis major muscle is used in reconstructive surgery to restore elbow or shoulder flexion, check out this video next.